And a local hospital is working to make sure that their personal protective equipment lasts as long as possible.
And Lauren, this morning, Alyssa Donovan has details on a disinfection process created by the staff at IU Health. Alyssa, good morning.
Well, IU Health has plenty of N95 masks right now. They wanted to find a way to make sure that that personal protective equipment can last as long as possible, especially now that the stay-at-home orders are being lifted.
As the state is opening up, we're all kind of collectively holding our breath to see how having more people out and about, how that's going to impact our numbers at the hospital.
And having this disinfecting equipment in place is giving nurses and other hospital staff peace of mind in case there is another increase in COVID-19 patients.
IU Health has a very good supply of N95 masks, and this is just allowing us to be a little more proactive in making sure our supply is safeguarded.
These UV sterilizers were being used daily in patient rooms for cleaning. Dr. Nathan Alves, assistant professor of emergency medicine at IU School of Medicine, built this system with PVC pipes. Alves says hospitals across the country are using various techniques to disinfect and reprocess masks.
And it depends on where you are and what you have access to. We had access to these room sterilization towers already. They were purchased in response to some of the Ebola stuff a few years back.
The system is currently used to disinfect N95 masks for Methodist, Riley, and university hospitals.
So each nurse gets that and they put that up to their face and they form that to get a good fit. And she puts her name and the unit that she's working on. And then when she's done with that mask at the end of her shift, she puts it in a brown paper sack.
A sterile processing team then picks up the masks and puts them on the rack where the mask gets radiated for a half an hour. The mask is put in a white bag and returned to its unit. At this point, N95 masks are only being used for specific procedures, so the system is not used at capacity. If it was, it could sterilize 3,000 masks a day. The process allows one N95 mask to be worn up to 4 times by a hospital staff member. That's opposed to before, when they could only wear a mask once before it had to be thrown away. I'm Alyssa Donovan, RTV6.